Anca, and this is the place to be to hear about the latest tech trends in healthcare. Many of you experienced your first remote medical appointment during the COVID-19 pandemic. If you are part of these people, welcome to the world of remote care. It is a world filled with exciting technology, easy access to care, and the promise of having a medical team in your living room. Sounds good? Keep on watching. Let me start with the story of Beths. She is 26 and pregnant with her second child. What was supposed to be one of the happiest days of her life, the birth of her baby, turned into a nightmare as she started bleeding profusely 1 month before term. As soon as she arrived at the hospital, doctors suspected a case of placental abruption, which means that her placenta was separating from her uterus, putting the baby's life at risk. She was immediately prepared for a C-section, and 9 minutes later, baby Ruben was born, but he was not breathing. The local medical team immediately connected with a specialized neonatologist via telemedicine to help in the resuscitation efforts. And it worked. The ability to visually assess the newborn made a huge difference in saving the baby's life. Telemedicine has been around for a couple of years already, and just like in Beths and Ruben's story, it helped save countless lives both in hospitals and at home. But if I'm bringing this topic up today, it is because the COVID-19 pandemic showed us that the potential of telemedicine is far greater than we had ever imagined. In the words of a British physician interviewed by the New York Times, the COVID-19 pandemic is the equivalent of 10 years of change in 1 week. Some would even argue that what we experience today is perhaps the biggest revolution in healthcare since the development of modern hospitals in the 19th century. What we see is that care is moving away from hospitals and into patients' homes. Through the use of technology, many specialists are now able to remotely monitor their patients and communicate with them in a simple and effective way. So here are some examples of the areas in which remote monitoring and remote care in general will have the biggest impact. Maternity. Now let's be honest, maternal care is a topic that is often forgotten by health tech companies. Yet it is a topic that concerns almost half of the human population, so the market potential is just enormous, and women are always seeking better, safer, and easier solutions during their pregnancies. Maternal and fetal remote monitoring tools allow clinicians to track vital signs of both mom and baby directly from home. This can help expecting mothers feel safer, knowing that if anything goes wrong, doctors will be able to detect the first signs and intervene. Perhaps such devices could have helped Beths' medical team detect early signs of placental abruption and avoid that emergency C-section. Chronic diseases. Now, this is perhaps the very first field that comes to mind when thinking about the benefits of remote monitoring. For a very long time, though, the health system was designed to mainly treat acute diseases, and chronic patients were often left behind. But those are not a small group of people. According to the World Health Organization, 1 out of 3 adults worldwide suffer from chronic diseases. But the explosion of remote digital care provides these patients with the tools to transition from hospitals to their homes in a safe and monitored environment. Now, knowing that not only your health is continuously monitored, but also that you can rely on at-home blood testing companies for your medical follow-up and on voice assistants to connect you to your medical team in case of an emergency really gives you that peace of mind. Chronic diseases can also be very time-consuming to manage, so any at-home care can save patients precious time and complications. And talking about blood testing, the pandemic provided diagnosis companies with the opportunity to expand their at-home testing solutions. COVID-19 swab test kits became available online, opening the door for a multitude of other medical tests. Dental care. At the height of the pandemic, many dentist offices closed, making routine face-to-face dental checkups nearly impossible. So remote dental care became a true challenge, but also the only alternative available in the absence of traditional dentists. Dental care companies are now developing smart toothbrushes using artificial intelligence to analyze habits and help patients optimize their oral hygiene. These toothbrushes can adapt to each patient and guide them through routines specifically designed for their needs. The COVID-19 pandemic opened up a whole new world defined by new consumer habits and new needs when it comes to healthcare. This new era leaves us with the opportunity to adapt our healthcare system, make it more patient-driven and more effective. Because everything from prevention to diagnosis to treatment can be optimized today, and unlike in previous years, we have both growing public demand and the latest technological innovations to help the community succeed.